Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is All Psych.
We are officially live on tape, hailing all the way from the internet. But I have a very special co-host guest I'm excited to introduce. I have stalked you for a while, Dr. Hart. I've threatened to move up to Tennessee to gain expertise from your wisdom. I referred patients up there because you are, I think, the very best at what you do. But most people would describe you as a chiropractor, functional naturopath. I would describe you as a healer because of your unique style, the way that you think big picture, even for a holistic doc, and the general approach that you take with patients that not only helps heal them, but also makes them feel safe and comfortable in your care. So it's an honor and a privilege to welcome you, Dr. Martin Hart. I want some applause from the gallery.
Oh,
we're going to get applause for next time, but
yeah, a little applause meter. Yeah, thank you for having me. I'm stoked to be here. It's been awesome getting to work with you with different patients and clients. It's been a fantastic 1-2 punch for me and my clientele, my patient base, working with you. And so I'm so glad to be on the podcast with you, hosting it, and giving out some great information together.
Yeah, it's interesting. The topic we're going to talk about is an area of particular interest and expertise in you. Mainly, we're going to scratch the surface of mold and Lyme disease because these are two illnesses I know you see all the time. They're two illnesses that the Western model struggles to have mastered curing. And it's particularly disconcerting that these patients suffer to a degree that's really hard to put into words. It's not like living with diabetes or psoriasis. This changes their life. It affects their ability to do some of the most basic tasks. I've had patients that literally have told me, if the house caught on fire, I would not be able to get out. I'm so weak. And it's stunning to me that so many doctors will just say, I don't know what to do with you. It's all in your head, or, more antibiotics. At what point in your career did you say, you know what? I'm not buying this model. I want to help people, and I'm going to discover how to do that.
Yeah, definitely a decade plus ago, it got to the point where it's like you're looking at the system and you're going, the standard you're taught is not working for most of these folks. It's not. And so at that point as a practitioner, you've got two options. You can keep hammering away at the standard and just telling the patient it's their fault, which to me, I can look somebody straight in the eye and do that. Right. So one of my living philosophies is the question, is that true? And if I'm yelling at them all the time that it's in their head, I got to start asking at some point, is that true? Which I've never done, but that's your one choice. Or the other choice is say, my standard is broken. Let me figure out a new standard. And that's the path I took. Let me figure out a different way of not just working with these folks, but like you said, their lives get turned upside down. It's like they're living in an alternate reality, sometimes for decades, until somebody comes along and help them. And so you're not just helping them heal, but you're changing their life. And so you gotta change the model to do that.
And this model's pretty well established. I would say naturopaths have come really leaps and bounds since the 90s. And they do something that I can relate to because many of our viewers know I was an engineer before a doctor, and I see the world through an engineering lens. I approach problems through an engineering lens. And I approach systems like our body, our behavior, our mind, as a part of a bigger whole. It happens to be a whole that is innately wise and is programmed to heal itself. And a lot of times you see these interventions where we're trying to essentially say we know better than Mother Nature, or hey, Mother Nature's not working right here. This whole menopause thing was, must have got lazy there. So let's give you some replacement hormones. And it really was appalling early in my career as well, how few people I could help based on all that shiny knowledge and education that I got. And if you ask why, you get a million more questions.
Fair enough. I was just going to ask what sparked it, but okay, we don't need a can of worms. Is there what would you say was the first thing you started looking into when you switched away from your previous model to kind of your current mindset, which I love? Systems thinking is really where it's at. But what was the first thing you started studying?
Probably, it's interesting. My whole life I've been left brain. I still left brain, although I've evolved the right brain. But one thing that shaped me very early on was I had a near-death experience when I was about 6 years old. And so they told my family they didn't know if I was going to wake up again. They had no clue when, because I had been in a coma. But when I came out and I was talking about all of these things that I saw during my core NDE, they didn't really know what to do with that. They said, well, that's probably an hallucination. That's cute. That was a very important experience for me. And that was probably the first time when I really felt like Western medicine wrote me off, wasn't listening to me. I had another serious injury when I was 17 that was misdiagnosed. That made me lose more faith. So I think it came in stages when I saw a lot of the pitfalls well before I entered medical school. And then in medical school, they even tell you, hey, we've got good news and bad news. The good news is 10% of what we taught you last year is wrong. And I'm thinking, that's the good news? What's the bad news? The bad news is we don't know which 10%.
Oh man.
That stuck with me. That made me like, you're admitting that much of this is wrong, but we don't know what, and it's going to flush out. So always kind of keep an open mind, see if things make sense, understand the physiology, ask questions, and you do get to the heart of people's problems. And then, first day of practice, when you're realizing it's very algorithmic. Well, if they have this, then give them that. They check boxes for depression, give them this antidepressant.
Yeah.
It didn't feel right, but more importantly, you just don't see people getting better. And that was when I changed.
Yeah, with your problem-solving brain you had from engineering, that was never going to fit for you, I bet.
No, I couldn't go to sleep at night and feel good about not helping 70% of the people I come into contact with. Yeah. So as I opened up the repertoire and I kind of discovered the holistic world, functional, integrative, whatever we're going to call it next week, these providers by design want to know why. They want to understand the how. They want to see the big picture. And that's why they get such great results. That's why they help people when no one else can. The Western model fails. It's really listening to the body, paying attention to it, tying all these symptoms together, and then looking for the root cause of the problem was when I'm never going back. That's when I was sold.
Yeah. Burn the boats.
Yep. Burn the boats. I had other interactions like that, but many of them helped shape me. And being worried about your reputation was a consideration. I think you and I had talked about that when we were young and coming out and wanting to establish reputation. Like, oh, I don't want to deviate too far from the medical narrative. And you get to that point where you're like, I want to help people. That's more important than anything. And I need to learn more than what I've been given.
It's really at that point, the doctor just becomes it's just the foundation. It's the baseline. If you're just riding on that, you're not doing enough.
Yeah. And lo and behold, it's fascinating. That's this journey of discovery. It's understanding the why the pathology happens, kind of what we thought probably medical school was supposed to be.
Yeah.
And I quickly realized it wasn't. And that was very disconcerting. So it's a vindication to me that I've come full circle, that if I understand the pathophysiology of mold, how it affects the body, why it affects the body, what else can it do, like run in packs with metals, then you get this holistic, this all-encompassing treatment and approach that changes people's lives. And that's why I got into this field. That's why you're so good at what you do. Plus, you're very compassionate. You're very professional. You're very well educated down this path, and all your patients know that you truly care. And that's sad that that's a dying breed or missing from our healthcare world.
Yeah, no doubt. I think, in my head, whenever I'm working on training other doctors, my viewpoint on it is, if you want to be a master clinician, you got to mix the systems thinking, right? The holistic viewpoint, like really understanding the systems, the engineering viewpoint with the passion and compassion. Because when you have the care and the connection with the patient with a good approach, it's hard to lose. And not even just from getting a patient totally better perspective, but of providing true care. When somebody says, I care, you're caring about them, you're actively caring. It's not just the treatment or the protocol you're giving them, but it's the approach you take. And so, yeah, I love chatting about that with you, because I think it's something we both do. I know the patients we share speak highly of you, and I love that I can have somebody that I can collaborate with and have the conversations with, but who I also know is going to take care of the patients I send them.
Yeah, again, my greatest regret is we're not in the same state.
I know you're trying to talk me into Florida. We'll see, maybe one day.
No, but I've told people this is a center where, especially complex, too complex for me, I know that I can send them to you, and you will go through all of the diagnostic protocols and personalize a treatment protocol that's specific to that patient and really that time. So they might not be as toxic 3 months on, let's say, mold as they are right now, whereas they might be more toxic or discover something else 3 months from now. You adapt and tailor make and personalize their treatment. And that's a model that we're working to develop down here at the Mind Body Medicine of Florida. And truthfully, a lot of our models, it has been based off of your design, your practice, and the previous practice as well, because it's to me, it's the perfect vision of the future of what we want healthcare to be. We know healthcare has to be in order to change the world, really change the practice in this country. And another thing I really like about you is your open-mindedness to both Eastern and Western. I feel like there's a lot of bipolar, or maybe polarization, and people are like, well, I don't trust Western medicine at all, and vice versa. And that same myopic thinking is kind of what got, your primary Western docs into a narrow set of skills. So you and I think very much alike, and maybe that means I'm a little bit self-absorbed and narcissistic because I admire you so much in the way that you approach things and people and the illnesses themselves, treat them like people. It's another thing that, at least down in Florida, a lot of people don't. They just feel like they're a disease. They walk into a sterile office and they get their symptoms treated, but the physician makes them feel as if they're just a disease and not a human being.
Yeah, the cold clinical approach. Ugh.
Yeah. So let's dive right into your wisdom on mold. I don't want to say like, what is mold, but maybe a good introduction about where we find molds, where they came from, what they do, what's good about them, what's bad about them, when do they become a clinical problem? What are your thoughts on that?
Yeah, so I mean, mold is basically fungus, right? So you can think of mushrooms, but really the mold we're talking about is kind of like, what you might find in an old loaf of bread. And so basically that bread starts to decay and it starts to grow mold. That mold is helping to break it down. And so we find that a lot of times you can have two viewpoints on it, or two approaches to it really quickly. Of there can be mold inside of us that is starting to break us down. We can have a mold infection, fungal infection, or we can have an environmental, like your house is moldy. And so that's usually showing up when there's something about your house that is breaking down. You have water damage. Water's coming in and it's damaging the wood or the structure. Mold is going to grow as that breakdown happens. And so typically it is from water damage, cold, damp environments that are getting watery, mold shows up. And so what that mold does is twofold. It can cause an infection, but more often it's releasing its own toxins. Every time it releases a little spores, like little mold seeds that want to grow somewhere else, they have toxins inside of them. And that's what really causes people to get sick a lot of times, those mold toxins, also called mycotoxins. I think that's a pretty good primer to start with there. You want to add anything, Dr. Sylvester?
Yeah, that there are some that molds have been around probably since the beginning of time. They're very necessary for not only decomposition, mold is probably one of the most important things after we pass out of this vessel to break down the organics and to recycle it. But they also have a symbiotic relationship with us on our skin, in our gut. We carry a lot of mold right here in our sinuses. We can get mold infections of the skin when things get out of balance, but there is this symbiotic relationship, and a lot of times they can help free up nutrients. So they're there for a reason. It's just dysbiosis and other things we've talked about on this channel before is when it becomes a problem. If there's a hit to the immune system, there are typical molds, and wouldn't you say they're region specific?
Yeah, they tend to, you'll find more different, like all the different types hit a different region more so. Maybe like a drier region in Arizona, actually you wouldn't think of it because it's so dry, but it does grow a different type of mold than say Tennessee or Florida will, that are going to be way more damp.
Yeah, so we might see a lot of aspergillus, a lot of candida, out west. What are some molds out there that we can think? Or more mycoplasma, or molds that are more robust, I guess, to these non-humid environments.
Yeah, we got to watch out for some of the different ones like Wallemia that grow that can be nasty. Where we get some of the antibiotics, but penicillin can actually cause a decent amount of issues for people if you're sensitive to that one. So there's a massive wide variety, and it does hit region specific, and kind of what you're doing in those regions. Are you like in Arizona, for instance, they're running their air conditioners all the time. And so that creates a secondary effect that interacts with such a dry environment. That's a good breeding ground for mold, unfortunately.
Do all molds release mycotoxins?
To some degree, technically, yes, but they affect us differently. I should say there might be a few that don't, but for the most part they do, but some are more benign than others.
Yeah, and there's some that we routinely see, and it's the bread and butter molds and or mycotoxins that come from them that we see concurrent infections like aspergillus and candida, or a candida overgrowth. A lot of people have had that at some point in their life. Their Western doc might say, hey, stick out your tongue. Yeah, it looks a little white. Why don't you take this nystatin, swish and swallow, or whatever. But are they really understanding the big picture of the total body burden of mold and its mycotoxins? That's why they're not getting better, right?
Yeah, I think, well, so you were talking so beautifully about the balance. How can we have a symbiotic relationship? And so you got to ask number one, is there a mold toxicity burden? We have to detox the patient, not just kill it. But two, why is it there? Why is candida, yeast, fungus showing up in the body? So you talked a little about heavy metals, and that's kind of a great repertoire. I'll let you dive into that. But I've also seen where generally, if there's just a toxic burden in the body, candida and yeast will overgrow to protect us. It's a buffer. And so if we just go killing it willy-nilly, we're going to release this huge toxic burden and huge inflammatory burden on the body that we can't handle. So when we say we want to take a systems view or a whole balance view, a whole system view, for sure. We don't want to see the first thing that's out of balance and just go for it, right? What we want to do is say, okay, there's one. Now let's see where else. It's a trail. It's giving us clues. Where are the rest of the clues to solve the puzzle? And so, I'll let you for a second rip on heavy metals and candida on that front, but just how often they go hand in hand.
Yeah. Well, let me bookmark that thought because we'll get to that. I was just generally gonna say that the molds that do release the more, we'll just say toxigenic responses, have mycotoxins, which are very good at causing inflammation. They're very good at weakening the immune system itself and or suppressing the immune system, because so much more of the resources of the immune system are now going towards managing these mycotoxins, clearing, processing, inflammation, all of the work that the immune system does, cytokine mobilization. But they can also even reduce the effectiveness of the antimicrobial treatments because they dig in and they form something that's almost like a super barrier. It's a mob mentality of mold toxicity, if you will, called a biofilm. And that's almost like treating a different beast, isn't it?
Yeah, I mean, at that point, it's basically like if you've got an army invading and they're just soldiers, it's going to be easier to attack those guys. But if they suddenly come in with shields and tanks and barriers, it's so much harder. Research is showing that biofilms can almost make an antibiotic totally, or antimicrobial, totally inert, like at no effect, because it's just blocking it. And so molds, candida, yeast, fungus, all of those, they form this beautiful, it's a neat to see, but it's hard on the patient, but this beautiful glue that keeps the biofilm and the microbes inside just growing.
And that's, I think, why a lot of people suspect that they might have mold. Maybe they don't have a provider. They go on Amazon and they buy some, anti-mold something, whether it's some proprietary blend some doctor came up with, or they just heard on the internet like oregano or something might be good, or an anti-candida, let's say. Maybe they take it religiously for 3 months and get nowhere. That's a perfect example of why, because the level of complexity of the mold matrix and the defense system of the mold itself is going to require a higher intervention. So what do you do in situations like that to combat biofilms or more dug in infections like the sinus itself?
Yeah, so let's say they have we'll just use a sinus as an example. They've got some biofilms in the sinuses, maybe they're mold. And so number one, I would want to make sure all your drainage and detox pathways are open. If we start killing stuff, can you get it out? And then number two, I'll make sure that whatever microbes are around that we're addressing. So then I might do a light antimicrobial treatment for a little while. And then once I feel like we have those under control, then we're going to go in probably with some variations of, I'll use various essential oils that are biofilm penetrators, sometimes directly in a nasal spray. EDTA is a great biofilm buster. Enzymes, kind of like digestive enzymes, but we'll use a different version of them, proteolytic, but they're just a protein enzyme, and those will help break it down. And so when you use those plus antimicrobial treatment and you're detoxing with it, now you can really get that stuff moving that's just been layered on there.
And did you say binders as well to try to encapsulate it while it's being escorted and processed out of the body?
Oh, for sure. I always joke with patients that, you can clean the house if it's dirty and you can just throw all the garbage on the floor and then you got to clean the floor up again. But instead, if we use a trash bag as we're cleaning, we can just take it out. That's like a binder. Your binder is your trash bag you're using. Put all that garbage and toxins in there and then just carry it out to the dump.
So you do something that I do with patients, which I absolutely love, and you explain in metaphor and imagery because people get that. That's something that rather than explain really complex biochemistry that one, they don't care about, they don't really understand. You create a visualization and you help them understand what we're doing and why. That makes compliance go way up.
Oh, yeah.
Whereas you could be doing all the right stuff and saying, well, you got this and you got to take that. And they may leave there and be like, you know what? I don't know. I'm not sure if I'm buying what this guy's selling, kind of thing. That's the perfect level of explanation, and it empowers the patient with accurate knowledge on what they got, what we're going to do, how we're going to do it, and where they're going to end up and how they're going to be healed from this, because it's nasty, right? Mold, wouldn't you say mold toxicity, especially in complex cases with maybe concurrent metal or concurrent Lyme, may be contributing to half of their symptoms, their subjective symptoms. It's not to be trifled with.
No, I think it's a lot of times it's a major rate limiting step, right? It's slowing every other treatment down. And, to kind of even talk about symptoms, I think a lot of people, if you haven't dealt with it, you kind of think, well, it's going to give you some allergies. And that's just scratching the surface. I've seen cases that dealt with mold and mold was giving them seizures, right? It was causing them like vitiligo and skin issues, massive gallbladder dysfunction, destroying the gut lining. It'll just mess with the gut. I've even seen some cases where, especially if the fungus was like a biofilm, I had one particular case, she had a fungal biofilm that had heavy metals in it that was hanging around near like the brain tissue. And for her,
where was that?
It was hanging around the brain tissue, essentially.
Wow. Okay.
More so in the lymphatics that would drain the cranium, but it was close enough that it was giving her basically mental health symptoms. She was suicidal. She had massive anxiety, panic attacks. And once we cleared those levels down, you had to work concurrently, like you're saying, we had to work on the heavy metals and the fungal issues and the biofilms. All of a sudden, and sometimes if we got the treatment just right, the screams and suicidal thoughts would stop instantly with like within 30 minutes of a dosage of her treatment. And so it's incredible how widespread and systemic the symptoms of mold and fungus can be.
You and I know that, and we believe that, and we've seen that clinically. I think the average person, that's a bit of a stretch. Like it's new information to them because they haven't been educated in the Western model, or their primary doesn't spend more than 5 minutes with them to explain this. They're not really trained to explain. My beef is the Greeks came up with the word physician, which means teacher. Okay, so we need to be teaching, educating. And if you can't do that because the system and the demands and the blah, 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 find a new system as a provider. If you're feeling that way as a patient, find a new provider.
Oh, yeah.
Because this is absolutely critical that people know exactly what they're doing, why, and why, because the patient's visualization and healing, we believe, is part of their success and outcome. We want them to visualize the biofilm being busted up. We want them to understand, no, I'm feeling this way right now because of a die-off reaction. And he told me this would happen. And in 2 or 3 days, I might just feel a little bit sluggish, may want to take it a little bit easier. They're more compliant. They believe in what you're doing, and they're going to be motivated to understand more and get to the finish line where they really, truly restored their functioning.
No doubt. You said earlier about the stories and the metaphors, and it really is for me. I love stories. I love the background. My wife always jokes, like, you may not know what song this band is singing, but you know about all their childhood and all that stuff. I love the background. And so for me, an analogy I always give patients is Lord of the Rings. Okay, there's Frodo, who's the hero of the story. That's the patient. They're the hero of the story. We just get to be the Gandalfs. We're there to help guide you. I might give you the magical sword, right? I might give you a treatment protocol. I might be in there fighting the battle with you, right? You're going through a hard time. I'm with you there side by side. But ultimately, it's you, the patient, who's the hero of the story. And so we need to work together as a team. It can't be me dictating this to you. You're going to be your own hero, right? And so, like you're saying, that really needs to be a teaching moment, an empowerment moment, right? Educate, empower, and then that way the two of you can actually create a better effect altogether. I get excited even thinking about it, because it's for me, it's more fun. For the patient, it's more engaging. They're more alive. They're more in control, have more freedom, and the results are better, hands down.
Yeah, I couldn't agree more. Because they're nasty symptoms. I mean, we're still stuck on mold. We'll move on to Lyme here in a second, but some of the symptoms that you could feel with mycotoxins, with mold overgrowth, and they're not necessarily pathognomonic, but if some of the listeners are hearing like, well, geez, yeah, I do deal with a lot of this or a lot of that. That's the kind of thing you might want to go to your provider to investigate. But mycotoxins are certainly notorious for causing fatigue, usually pretty crushing fatigue, debilitating. Headaches are very, very common. A lot of mold is in this moist goo called our sinus.
Yeah.
And it's well protected. It's got the biofilm, but very close to the brain in terms of affecting brain fog, like you said, seizures, headaches. You can get a lot of myalgia, muscle pain, arthritis, joint pain. You can even get nerve involvement with numbness, tingling, pain itself, nerve pain. You can get weakness where you're like hard to get up out of a chair. That's odd. I'm a young person. Why is this happening? Heart problems, heart arrhythmias, you touched on, and I'm so grateful, a lot of the psychiatric symptoms. So anxiety, antibiotics cause anxiety, and similarly because of die-off, your primary care is never going to be telling you these are possible symptoms, but explaining that they are and why makes sense. So you do see anxiety, depression, irritability is very common. Sometimes after glutathione dose, if it's too high and you mobilize, that patient will get very irritable, certainly delirious, certainly psychosis, certainly problems with thinking, attention, memory, language, computational stuff. Matter of fact, I think you have I don't remember, it was on your website. There was a test to kind of assess that functional component as mold being responsible for interfering with that, which I thought was really kind of interesting.
Yeah. There's a VSC test, the visual contrast.
Yes.
That you can do. That it's pretty affordable online. I'll try to make sure that we get a link up on the notes. But it basically, they've shown now in research that it tells you how much biotoxin load you have in your brain, how much mold toxin load. It can also go with Lyme biotoxins in the brain, but it's actually very accurate. And you can use it to monitor progression of treatment.
Yeah, and it's a dynamic way to really give you one more clue that that's what you're dealing with. Yeah. And treatment wise, of course, this is just a general comment. This isn't intended as medical advice for anybody watching, but your provider may do several things if they suspect mold. Why don't I kick off the most obvious, and then you get into the PhD level interventions. But hey, common things are common. If you got mold, get it out of there.
Yeah.
Remove the offending agent. So a lot of times providers don't do that. Even the holistic providers, if you don't know the exposure source, whether that's occupational, whether that's in your environment because you like hiking, whether that's at home, like you said, a sick home, you got to identify the source, got to get it out of there, remove it, or else anything after that is kind of diminishing returns.
Yeah.
We did talk about binders being somewhat useful, and those are things like charcoal and bentonite and chitosan, and dealing with the inflammation. Why don't you touch on that, because we got to calm the mold-induced inflammation. What does that mean, and how do you do it?
Yeah, so chronic mold exposure and chronic mold toxicity, one of the medical diagnosis term is chronic inflammatory response syndrome, because basically every time that person is exposed to mold, they're having a massive inflammatory response, which again can affect the whole body. And so there's various ways we can deal with that to bring that level down, but some really important ways that are standard across in treatment is you got to do the fish oil. And the fish oil is important for a couple of reasons. Number one, it's anti-inflammatory, especially for the brain. But mold directly, so all of your cells are like kind of goo balls, if you will, and they have this fatty membrane around them. They've got like this butter around them. Well, mold disrupts that. And so the contents that are inside spill out, those cells die. Well, fish oil helps to heal that a bit. It's really important to heal that up. And so fish oil is going to be a big factor for the inflammation of with mold. And then you can get a little more nitty gritty if you can tolerate it. Turmeric or curcumin is great. Just making sure you get your digestive enzymes in for anti-inflammatory action is fantastic, because those are actually anti-inflammatory. And then I'll use some cocktails of herbs, but very primarily if you're dealing with neuroinflammation with the mold, it's going to be skullcap. Hands down, I love that herb for anti-inflammatory aspects.
And vitamin C, certainly, right? More in the liposomal forms. I mean, it depends on where you think bulk of this mold is going. If we're trying to bust up mold in the sinuses, you might do silver lavage versus in the thrush, you might use a anti-mold product there. In the GI system, you might swallow vitamin C capsules. If you're looking at more penetration into the epithelium or other more difficult areas, liposomal vitamin C, or I think probably the most powerful bang for your proverbial buck here is high dose vitamin C intravenous, because it really can mop up the blood, get into the interstitium, really kind of work on a cellular level out. And it's very toxic for mold.
Yeah,
for sure.
I've seen some cases where they've had acute mold exposure. Like we were cleaning up mold toxicity for them, and they had an acute mold exposure. Maybe they stayed in a moldy hotel, and they were kind of crashing. And I've seen a bag of IV vitamin C IV just bring them right back out of it, because it is massively, anti-inflammatory for the system. Big old antioxidant to clean it up. You're right.
And then I suppose the last thing we'll talk about mold is certainly optimizing the gut, liver, gallbladder functions, like you were saying, because they're absolutely necessary to eliminate those toxins and keep the levels down. As the immune system comes back up, then it can functionally do it on its own, unless we're missing, let's say, co-occurring Lyme disease. How's that for a segue? So let's talk about Lyme disease separately first. But what is Lyme? Where does it come from? Why do I care about it? Why do people worry about it? Or more importantly, should people in Florida know anything about Lyme?
Yeah, so Lyme disease, it's a bacterial infection by a bacteria called Borrelia burgdorferi, but there's actually other species that can cause it now, they're finding. Originally, it was found by a doctor up in Lyme, Connecticut. That's where its name comes from. They were finding a bunch of kids getting randomly sick with fevers, joint pain, headaches, which are the standard Lyme symptoms, body aches. But the problem with it is, we thought it was confined to the Northeast United States. Now research has shown it's in all 50 states. That means Alaska and Hawaii too, and that means Florida, right? And so usually we find it's transferred by ticks, but they're now finding it can be transferred by mosquitoes. Some of the Lyme and co-infections can be done by fleas, flea bites, spider bites can do it. Research is showing it can be transferred both from mother to child in utero while she's pregnant, if she has active Lyme, or from sexual partners. So like husband to wife or what have you, but sexual partners can transfer it through the body fluid. And so it's a little, they call it a spirochete shaped bacteria. It's a little too specific, but it's got a corkscrew, which actually is a really big deal because it means it can travel around a little better. It really is mobile. So I think that's a pretty good intro, but it's pervasive. And what they're finding is there's over 300,000 new cases per year of Lyme disease. It is spreading so fast, much faster than we ever gave it credit for just even 5 years ago. It's moving like wildfire through the country and actually through the world. I get cases in from Europe and Australia coming in that they're to stick with Lyme disease and they don't know what to do with it in their country yet either.
Well, now that I'm sufficiently terrified, because there were a number of other things I was supposed to be terrified of, none of which we're allowed to say here if we ever
right.
Yeah, not get banned. But symptomatic, it in a lot of ways, it's similar to the symptoms you would get from a mold burden. So I guess a big question that I get a lot is, how do you differentiate symptomatically? I mean, we know in terms of the testing and the provider, I don't want to snow people with that, but what are some differences? I mean, from the very beginning, like one, you'd have a bite, right?
Yeah.
And then the classic bullseye rash may or may not be there. That's kind of what I'm thinking. And then, fever, maybe a fever in both. What are some of the clinical differences that people should know about?
Yeah, so there's the rash, and there's multiple rashes they're finding. So you can have the bullseye rash. Even a lot of Lyme cases get a lupus mimicking rash, which a lot of times actually Lyme gets or lupus gets misdiagnosed when it's actually Lyme disease because of the way it can throw off the autoimmune markers. So you can get multiple rashes and even knuckle rashes. I've seen a lot of those cases, and that's in the literature as well, the research, and they end up with rashes. So rashes tend to be a bigger factor a lot of times. I do find while you can have joint pain with mold, I find joint pain and the muscle aches to be a much bigger factor. They call it Lyme arthritis and Lyme disease. And then the other big factors I find with mold is that the symptoms, both symptoms come and go, but I find mold symptoms come and go based on exposure. Whereas Lyme symptoms, I find more often come and go based on how much you overdo it.
Or maybe how much you overwhelm your system trying to treat it can make them temporary. It's that whole, you got to retox to detox phenomenon.
Exactly.
And how long can you carry around mold and or Lyme?
Oh, decades. As long as it has a place to reproduce or hang out. The typical idea, people say, there's no such thing as long-term Lyme disease. Well, the truth is I got to be a part of a research study where we found that it did hang out for decades, right? We found that people were still positive decades later after initial. Now the microbes may be different. There's like the relapsing fever, Lyme type bugs, the Borrelia type infections that last a long time. Mold toxins just sit for years and years. I've had patients test positive for years. And so, don't necessarily buy in hook, line, and sinker of the idea that, you've got it for 21 days and you're good. It'll be gone, or maybe just a round or two antibiotics and it'll be gone. That's not been my experience with most, at least complex cases. And so it'll live as long as it can reproduce.
And what's interesting is one thing it shares the common feature with is that the chronic long-term. So most people get this exposed to, let's say, the spirochete, the Borrelia burgdorferi. They get that infection and then they clear it. Right. Most people do that. But we know that there are people that don't, and they will carry it along chronically. Similar to mold, really. If you get an acute mold exposure, most people will clear that. If it's a single event and it's exogenous, they can clear that. Same thing with a heavy metal. You see where I'm going? There's a pattern here. And there's this virus that we've been talking about for 3 years that has long hauler symptoms, very, very similar between all of these illnesses, because it shows an incomplete ability of the body to completely eradicate the offending agent or the consequences of the offending agent. So anyone with any chronic illness should be seeing a functional doc to rule these in or out.
Right. Well, I think, there's a beautiful analogy that blends in here of like, if you're just stuck in the purely Western model, those are like firefighters, right? So if your house is on fire, you want them to come in, you want them to chop your door down, and you want them to hose the whole place down regardless of consequences. You just want them to put out the fire. And that's great. That's what they're good at. But tomorrow, after the fire's out, you don't want to call the firefighters back up with their axes and fire hoses. You want to call the carpenters up. And the carpenter's going to they're going to look at the whole picture and see, what do we need to do to fix this house? What do we need to tear out? What do we need to repair? Because when that happens, when the next storm comes through, you want your house repaired, fully structured. So when Lyme comes through, you don't want a house that's been damaged. You want a house that's been fully repaired and functional, right? So that storm is like Lyme disease coming in. Why can't they clear it? Because the foundation's messed up. And so you want a functional person who's going to take a look at it like a carpenter. And they're going to look at the whole thing and see what needs to be repaired in total. What all can we do to get this house totally functional and livable again?
Music to my ears, because like I said, I love analogies. It's a great way for people to understand more complex. It's a great way to create an image so that they'll remember this. So they truly are part of the healthcare team, because a lot of times they just feel like they're being spoken at, treated like an illness, throwing pills in their general direction. They may even ask questions and the doctors don't want to answer them, don't know how to answer them, don't have time to answer them. Yeah. So the model, and again, I feel like you and I are maybe twins in different states trying to do the same thing, trying to change the way that we assess and treat and heal folks. And it's a big task. But I think as time goes on, especially after what we've been through as a society in the last 3 years, a lot of people's attitudes have become a lot more open to looking outside that classic Western model that has failed them.
Yeah, it's breaking down. So I think they've got to open their eyes now. There's no doubt on that front. And it's, as we look at it, even with Lyme disease, I think the key that we're seeing is, the general idea is bacterial infection, antibiotic, all done, right? And as any Lyme patient out there knows, or if you're suspecting, you got some of the symptoms we're talking about, maybe if your doctor gave you a 2 or 3 week course of antibiotics and you're still sick, is that it's so much more than killing the bacteria. You have to look, do I have heavy metals? Do I also have mold? Is there inflammation that Lyme disease is creating I need to deal with? Is there a gut issue that's really lowering my immune system? Right? So how much of your immune system is really created in your gut? And so if you're dealing with mold, candida, yeast, other dysbiosis, leaky gut, it's going to be hard to heal from Lyme disease because your immune system is always handicapped, right? And so you really do have to take that approach and say, find a practitioner like Dr. Sylvester and myself. We're going to say, hey, what else is going on here that's keeping you from getting better? I know you have Lyme disease, or I know you have mold for sure, but what else is keeping you from getting better from that we need to also deal with on that front? And I think a big one on that front is that Lyme disease is caused by a Borrelia infection, but it comes with a family of microbes a lot of times. So it might come with like a parasite like Babesia, which is a protozoa, or it might come with another bacteria called Bartonella, right? Or some of the different viruses like Epstein-Barr virus, which causes mono, often comes along that front, or other viruses that pack in there. And so you have to be looking at more than just Borrelia. So if somebody says, oh, my doctor did a Lyme disease test and it was negative.
Right.
I'd say, number one, what tests do they run? You need to run multiple tests to see, because it's sneaky. maybe if we get time, I'll talk about that, or maybe we might have to do that. I don't know. But also, you need to test for the family of bacteria that come with it, because maybe your body, like you said, maybe even your body did clear the Borrelia. It cleared the Lyme disease, but it's still dealing with this other family, and it feels about the same to you.
Yeah, and not, that's that myopic nature. It reminds me of one of my favorite horror movies, Christine by Stephen King, where he gets that old beat up Plymouth Fury, and first thing he does is put a brand new windshield wiper on the crack, the cracked windshield and destroyed car. And
Yeah.
boy, that's a great analogy for kind of how we try a Western approach to rebuild and restore it. So you absolutely have to approach patients in that way. It was a good segue into heavy metals. Briefly, I just wanted to say, what is your understanding about, maybe this is a chicken and the egg question. Is it important to know what set the illness ball in motion first? In other words, did they get Lyme, which then allowed mold to get out of control, and then that attracted metals, or is it heavy metal accumulation burden that then liberated EBV or stored viruses, and then they have concurrent mold burden because Candida compensatorily loves to hang out and make buddies with mercury. Is it important to know the order of infection for treatment?
I kind of said this earlier. I'm so fascinated with background stories and stories. I do try to figure it out because I do think it helps me sort through kind of what ticked it off. But I think in the long run, as long as you know all the pieces to the puzzle and you have a good puzzle builder, a good practitioner, you can start to put it together, even if you don't for sure know. But in my opinion and in my experience, if you miss out on that, it could potentially be a booby trap later that gets you. Right. And so I see a ton of, like, for instance, two big ones I've seen a ton of is, actually we'll put them together, is like amalgam fillings. Okay. And so, which is like has mercury and other heavy metals in them, but also causes dental infections. And so those folks maybe had those amalgam fillings for 20 years before they got sick. And then they got Lyme disease, and now they can't get better from the Lyme treatment until they deal with the heavy metal burden. They get the amalgams out and they do some heavy metal work, like the chelation work and detox you do. And so on that front, though, if we didn't recognize that, we might be spinning our wheels forever in treatment until we recognize, hey, really mercury load is what lowered your immune system enough that you could even get the Borrelia infection, the Lyme infection to begin with. And so we need to deal with that. And so when you do know, at least in my opinion, the order, or at least you know the puzzle pieces, the treatment can actually become more comprehensive and therefore more effective.
So in the case of the metal, if you'd had Lyme in the past as a kid or whatever, do you see reactivation of Lyme? Like, we definitely see reactivation of mono, Epstein-Barr, varicella, chickenpox, CMV. You see reactivation of all these illnesses that, quite frankly, you should never see activated under normal circumstances. Does Lyme do the same thing?
Oh, yeah. For a lot of people, especially when they're kids and maybe they're somewhat more healthy, right? They'll get Lyme disease from a tick bite and their body will clear it and the Lyme will go dormant. They could potentially live the rest of their lives and never have a problem. But then they get an amalgam feeling or they have a heavy metal exposure, and it creates such a burden on the body that the body no longer can deal with that load. And like an analogy is like, maybe you've got a very small crime problem in town, but it's so small that nobody's getting hurt, right? But if the police force suddenly gets overburdened with this other issue, now that crime can flourish, right? Before it wasn't a big deal, but now there's suddenly murders happening because the police force is too busy. The body happens that same way. If we've got to suddenly deal with something that's so uber toxic like mercury or lead, for instance, or uranium, well, then suddenly there's no energy left to deal with the immune system and to deal with that Lyme. So Lyme says, hey, I'm gonna populate now. I'm gonna come up and get mine. I'm gonna get my food and grow. And so then the body's dealing with two things now. Now it's dealing with the burden of heavy metal toxicity and Lyme disease. And so as a practitioner, you got to be looking for whatever is triggering it one way or the other.
That was a perfect explanation. I think that's very clear to our viewers. And I think viewers know this is why it's important to have a good functional medicine provider, because they do understand all this. Plus, they understand the science and the intervention. So a lot of people try to self-diagnose. A lot of people like to go on Google or whatever, and they like to look up symptoms, or maybe they're convinced they got this, that, and then maybe they find a few like supplements or things that they can take. I would caution people against doing that for the reasons that you just said, because there's a much more bigger picture where there's a lot of interconnectedness, most of which are counterintuitive, I think, to the average person. Like, what does this have to do with that?
Right.
So go see, my recommendation is to go see Dr. Hart. Beautiful new facility. I'm waiting for, no, you already gave me the invite up there, so I can't say I'm waiting for the invite. But when you get when you get to a place where you want a visitor, I would love to come up and see a new place and continue to refer to you are really complex cases, things that are above my head. I can't thank you enough. It's an honor and a privilege to have you here. You give me hope and faith in humanity and medicine, and that we're all going to be okay because we have people like you and I that care and know that this is the model that's going to help heal people, give their lives back.
No doubt. Definitely get their lives back. It's a big one. And I really enjoyed the conversation today. I love rapping back and forth with you on these things, and love to have you up to Nashville, take you out to some country music, or be down to Florida next time. I'll definitely hit you up because I love it. And, just like you're saying, find your tribe, because we're out there. Find your like-minded individuals, find your support team, because that's what keeps us going. That's what keeps the right direction. Even if the world is crumbling around us, when you have your tribe, it doesn't matter.
The tribe is important, but it starts with you. Trust your gut, trust yourself. And I think you'll be led. When the student is ready, the teacher appears. So if you can't remember that, then go to KeystoneTotalHealth.com. And we're going to have some links below in the description as well. Dr. Hart, thank you so much. I hope we can do a part 2 to this and maybe get a little more in depth, go down the rabbit hole for some of our more advanced listeners.
Twist my arm. I'll make it happen.
All right. You got it on tape. You got that? All right. We got that. There's not really anyone over there. I just do that for effect. So, all right. Well, then join us next time. We have a very surprise guest. You'll just have to wait and see. Until then, be well.
Thank you, guys. You take care.